treatment of cellulitis and panniculitis. The aim of this video is to provide you a number of very effective techniques to solve cellulitis and panniculitis. First, however, we have to make a distinction between cellulitis and panniculitis, the cause of each one. So our aim is not to solve this problem or to improve it considerably, as most of our colleagues do, which aim strictly at loosening the part involved, and that's it. We are going to do all the work that comes before that so that we get a long-term result and so that it will not reoccur so quickly. Now I'm going to try to explain to you in very simple terms why cellulitis occurs. Well, there isn't one single reason. In fact, there are different ones. So we can suggest our client to drink more water away from the meals, to do more exercise, and especially to reduce the quantities of food during regular meals. In fact, instead of having breakfast, lunch, and dinner, I always suggest eating a little bit less during these meals and to compensate for that with a small snack in mid-morning or mid-afternoon, a fruit-based snack, that is. So by doing this, the person will already improve, but only to a certain extent, and that's where we come in. So now I'm going to teach you these techniques that we are going to use so as to move not only the body part concerned, like in the thighs for women or the gluteus or the inner knee. And I also want to point out that these blemishes are typically found in women, whereas in men, usually we find this to occur in the abdomen. That's because of the female hormones that withhold this fat and in the thighs and in the gluteus, whereas in men, because of a surplus of male hormones, they tend to somatize a lot in the abdomen. So far, so good, right? Okay, so far I've explained to you cellulitis. Now, panniculitis, in the other hand, is different from cellulitis because in this case we have fat spread throughout the body. So in the abdomen, on the back, in the arms, it's spread out throughout the body. By far, one of the most common techniques for improving cellulitis is lymphatic drainage. If you know how to do it already, then you can alternate all these techniques with a session of lymphatic drainage. So you could do one session of treatment and another of lymphatic drainage. However, I have to be honest, lymphatic drainage will not suffice, especially if you want to obtain a long-term effect. If you're interested strictly in relieving the swelling, then it's okay, but otherwise it will not be enough. So kneading. First we're going to use the kneading technique, and then we're going to do the palpé-roulé technique, which you're already familiar with. Then we will do cutaneous and subcutaneous stimulations, and in the end we will do a lymphatic drainage. So let's start with kneading the thigh. So we rub some oil in our hands and we start slowly. And we can divide the thigh into 3 sections: the top part, the inner part or section, and the external section. So right now I'm working on the central section, the top section. You see, I'm kneading. I start from the knee. I use both hands. It has to be quite energetic. It could hurt because cellulitis, when it is inflamed, even with this kind of kneading, may cause pain. So you will do it anyway, but try to measure out your strength. Now we have to loosen and massage the inner thigh zone. So We knead it first. We have to go very softly about it, even if it hurts, because remember that in the inner thigh we find a lot of lymph nodes, and to avoid irritating them, we have to really go lightly about it. Now we're going to loosen the external section. Now, in order not to bend your back too much, I suggest that you kneel down and then start kneading where you find the most concentration of fat. And so start loosening it. How long does this have to last? Well, that depends on the amount of cellulitis or on how swollen these legs are. It may vary from 2 to 3 minutes, which will already be a good start, to up to a maximum to 10 minutes per leg, which I realize is a long time, but we really have to stimulate these muscles. Another area that is usually affected by cellulitis is the inner knee, and so here we also have to do our kneading. So even here, this will be a lower scale kneading, and you loosen up the part. You got a friend in me. You got a friend in me. Once you've completed the kneading process, then you have to work on the lymph nodes in the inner thigh. So you place your hand at an angle towards the inner thigh. This is the right direction. And then you do this sort of emptying motion. It's easy. I'll show it to you in a slow motion. In fact, the movement of the hand has to be slow. I'm going to show you with one hand. This is what my left hand is supposed to do. It's like a wave. So you squeeze, because these lymph nodes, which can be compared to a bunch of grapes that must be squeezed through this technique. By squeezing them, the lymph will be emptied in that area and then will be reabsorbed. You see? My other hand is only supporting my left hand, the one below. This emptying motion can be done for 30-40 seconds, not more than that. Once you've completed, then you move on to the next step. Palpé roulé technique. The palpé roulé technique will come in when you have to do this along the meridian, as I'm showing you here with my drawing. This is where the person tends, in the thighs at least, tends to somatize most of the cellulitis. Okay, so you start from the knee or under the knee, and then you slowly move upwards. This technique, just for a change, causes a lot of pain, so measure out your strength and also ask your customer to have a little bit of patience. Also, because with this technique you can really carve the legs. Once you have completed the external segment, then you have to do the palpé roulé on the upper part of the thigh. You can also start from the top part of the thigh, don't worry. So you can do this both on the top part and in the inner thigh. Always remember to go lightly when you come near the inner thigh. I hope you appreciate these pictures. I like them a lot. but they're certainly difficult. They've been difficult to shoot because I have to hold the tripod between my legs, and the camera is basically underneath my nose, so it covers my view a little bit, but because the result was really excellent, then I thought it was worthwhile to do this. Now, I didn't mention this at the beginning of the video, but I will mention them now. We're going to do this percussion to solicit all the leg muscles. It's very simple, you see. You just have to beat your fists in an alternating fashion. Without touching the inner thigh. So you're working on the top part and the external section.
Okay.
Now, if it hurts too much, you can place your hand and you can do this percussion directly on your hand.
Sulla tua mano.
Cutaneous and subcutaneous stimulation. Now, what is this cutaneous and subcutaneous stimulation? Well, it's a stimulation that we will do for the more superficial nerve endings and also for the deeper nerve endings. So we will divide the leg into many lines that will go from the top to the bottom, as you can see here. I'm going to show you this in a blow-up picture. These are stimulations that must be done with your fingertip. So you can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. There is one extra. So I'll show you this blow-up picture. You see how you have to do this? Now I'm just doing a small section. The important thing is that you go from the top all the way to the knee. That's the stimulation. Now, if you want to stimulate the subcutaneous nerve endings and so solicit in a deeper manner, you will use your nail. Although you have to file them beforehand, it can be very, very effective. This technique is used a lot in osteopathy. Okay, so we always divide the thigh into 20 lines, starting from the inner thigh, the upper part of the inner thigh, to the external section. And we'll do this 20 lines, which will be repeated 3 times. Now I'm going to show you how to use your nail to do the stimulation. This is the right angle. You can use the right hand or the left hand. The important thing is you go from top to bottom. The first steps, that is the first 20 lines, which you'll have to repeat 3 times, so you have to do 20, 20, 20, will be lighter, a lighter scratch. The second time it will be a little heavier, and the third time you'll apply even more pressure. You can see the skin here in the area that I'm showing you. The skin will turn red. This is good because we have to cause hyperemia, that is, we have to provide blood supply, as much blood supply as possible, because usually who has cellulitis has cold thighs, which means lack of energy. Now these steps will be done also in the inner knee. So first you do the cutaneous stimulation, that is with a finger without the nail, and you do this 3 times. And then you start working with your nail. You see? Exactly. You comb the nerve endings. Consider that it's going to turn red very much. Once you have completed all the steps for one thigh, then you move on to the next thigh. So after you've done the kneading, the palpé roulé, the percussion, and the subcutaneous and cutaneous stimulations, I have already moved to the other thigh. I've done everything that I just mentioned. And now I want to show you in these pictures, which are a little bit clearer, the cutaneous and subcutaneous stimulations. This is the cutaneous stimulation. You start from the top of the thigh and you do 20 lines. It's very, very simple and you can't go wrong. Once you've completed the 3 steps of 20 lines each, then you can start with the subcutaneous stimulation. Now I want to show you how red this is going to turn. You see it's very intense, it's dark red. Now you have to explain to your customer what you've done. Tell him or her that in a couple of days the entire effect will be reabsorbed. If it's going to last longer, it's because there's a lot of toxins, histamine, we've talked about already, under the skin. But explain to them that this is going to be reabsorbed anyway, so they're not afraid, and they understand it. If they go home and they haven't understood, they're going to tell their husband or wife, that they may get worried. Instead, if you explain to them, then everything will be fine. Facing downwards. Now, we have asked our customer to lie down with her face down. We're going to use a piece of paper for the sake of professionalism. Perfect. So that we don't stain the slip. And then we'll start working on the top part of the thigh. So first we start our kneading technique, deep down. We will work on the upper, lateral, and inner thigh. You have to be careful not to apply too much pressure on the popliteal fossa or the knee pit. Okay, then we can start the percussion on the central and external segment of the thigh. Avoid the popliteal fossa and the inner thigh. Now, the whole treatment of the legs, including what we're going to see in the next, should last about an hour. Once you've completed the percussion, then you have to start the cutaneous and subcutaneous stimulations. So you have to stretch the skin a little bit, and when the skin is stretched, you start first with your finger, and then you work by putting your finger at the right angle. You do the subcutaneous stimulation so as to reactivate the blood circulation. So don't worry if the part turns red. The important thing is that you explain it to the customer. Now we have to do the palpé roulé technique on the gluteal region. Don't forget this step, because again, I know I've said it many times over and over, but believe me, this is a very, very effective technique. You can actually model, you can carve the body, both in the gluteus and in the outer thigh, or parts where this usually occurs. Calf. Now we have to work on the calf. So we start first with the palpé roulé. We start from the top part. Don't work on the popliteal fossa, and slowly you move downwards. The work on the back of the leg should last from 10 to 15 minutes, including the thigh. So you will do 15 minutes for one leg and 15 minutes for the other leg. You will have already done when the person was lying with their face down. You did 10 minutes on one thigh and 10 minutes on the other thigh, and you will have another few minutes for the things that I'm going to show you next. Once you've completed the palpé roulé, then you start the percussion on the calf so as to solicit it. After that, you will start the cutaneous and subcutaneous stimulation. This you have to do from the popliteal fossa to the knee. So as you can see, it's done quite rapidly. Be careful though that when you use your finger on your finger or your nail, you have to do this continuously. Don't do like many people do, just scratch a few centimeters. You have to start from the top and you have to go all the way down to the bottom. This has to be done 10 times for the cutaneous, for 3 times, and then you do another 10 times for 3 times of subcutaneous stimulation of the liver and gallbladder metameres. For all those who have followed the metameric massage course, you have learned that in the fascia between one shoulder and the other, we have 2 metameres, that is the liver and the gallbladder metameres. So we have these nerve fascias that bring the communication to this organ and to this viscera. It's very important to stimulate this area, and this is where we will make the difference with respect to the rest of masseurs or masseuses who only treat the body part, because by improving the nervous communication from the liver and the gallbladder, we will try to optimize the fat metabolism, because you have to know that the gallbladder in particular acts as a digestive apparatus and to absorb the fat molecules and making them eatable by the mechanism. Notice the redness here in this body part. We've just finished working on the liver metamere, and now 5-10 centimeters below we have the gallbladder metamere. Now, because both liver and gallbladder are positioned on the right side of the body, so will the metamere be more developed on the right hand. And you can see here that I'm working on the right hand of the customer's back. Now, especially if the person is very tense, between these 2 metameres, it's going to be very painful to do this from the center outwards. So you can use this technique that I'm using right now and just work on the spinal cord. Here again, you can see the redness in the body part after you've treated it. Papérolé of the liver and gallbladder dermalgias. Okay, so after you finish working on the 2 metameres, you will now need to stimulate the metabolism directly by stimulating liver and gallbladder on the body, which are found in these 2 zones, which are called dermalgias. So as you can see, abreast the rib cage line, we have the gallbladder. You can see it in the picture on the left, and immediately underneath that we have the liver dermalgia. So again, going back to my model, you can see we have the edge of the rib cage. We're on the right side of the body, and we stimulate it by pinching the skin from bottom to top. Perfect. This area will also turn red, and that's perfectly normal. It hurts, so measure out your strength, and you work it for about 1 minute. That will be more than enough. You see the redness here? Immediately underneath the rib cage, immediately above the rib cage, we have the liver dermalgia. So here again, we stimulate it from bottom to top. In fact, you could also work from top to bottom, but then you would have to position yourself on the other side of the cot. I think it's more practical to do it this way, and you won't go wrong. Stimulation in foot reflexology. Now, here we have the liver zone, and this is underneath the 4th and 5th toe, right on the foot. Now, underneath that, we have the gallbladder zone, which is the one that I'm drawing now, and we have to stimulate as much as we can for 3 or 4 minutes these 2 areas so as to reactivate as much as possible the energy connected to the liver and to the gallbladder. Okay?
Okay.
So here we are. This is the liver zone. You see, I'm right on the third and fourth joint of the third and fourth, or the fourth and fifth toe. Now, it will be enough to do this for 2 minutes. Immediately underneath is the gallbladder zone. Treatment of panniculitis. As I said at the beginning of this video, people who suffer from panniculitis have fat spread throughout the body. So not only on the inner thigh and the gluteus, but they also have fat on the belly, on the back, and on the arms. So this fat is spread across the body. Now we have to stimulate this body, we have to burn it. So after we worked on the foot with the liver and the gallbladder to reactivate this mechanism for getting rid of this fat, now we have to work on the body directly, and we have to move it and loosen it, and we have to help reactivate the blood circulation, but also the energy, because if the part is more vascularized, then we will also help reduce the fat. So here you can see you're going to work on the external part first, then you slowly move to the central segment of the abdomen, and then you will massage the body part towards you. So the other external segment, 5-7 minutes will be enough, even because after this we will need to do the palpea relay technique. Okay, so pay attention now, because we have to do the palpea relay from bottom to top. This is the technique that will allow you to carve the waistline, and it's very, very, very effective because it actually carves the body. The results are immediate. It hurts a little bit for a change, but it really is very, very effective. So focus on this. Start from the bottom, move upwards towards the navel, then you do the central segment, and then you will work on the other side. Now, to help to facilitate the palpea relay technique and not to keep my back curved, I'm kneeling down so that I can hold my back straight and not get tired after 10 minutes. Okay, once you've completed one side, then you move on to the other side. So you go around the cot. And once you've completed the palpea relay, this also will last 2 to 5 minutes. You will then move on to the percussion, which we'll do differently from before. So here you place one hand, and with the other you beat on your other hand. You see how this affects the whole abdomen. If you were to beat our fist directly on the abdomen, that would hurt. Another technique that is very, very effective, other than the palpea relay technique, is the subcutaneous stipulations. You see, I can do this with the fingertip, with my nail, but it's important that you first stretch the skin. So you pull the skin, and then I scratch the skin. From the pubic area, you have to move towards the navel. See, that's the direction. Well, when you're working on the side, you can do it from top to bottom, and I'll show you this in a minute. First, however, we need to work on the upper part of the abdomen and stomach. So you see, I stretch the skin and I always move towards the navel. You can do this for 2 or 3 times. You see, you do this about 10 scratches at a time, or you can also do 20 if you like. The important thing is that this is the effect that you see here. And then we have the side area, the lateral area. You see, you have to pull the skin and then you scratch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay? Good. I think that's quite clear.
Bene, è chiaro, vero?
Okay, so be careful. Once you've completed the subcutaneous treatment, you will need to see these scratch marks, which don't have to look like whip marks, otherwise the person will be worried. So these scratches will be reabsorbed in a couple of hours. At worst, it'll take 1 or 2 days, but if you tell the customer beforehand, they will accept it and nobody will be annoyed. The important thing, again, is to explain to them why you did them, and you will realize later that these are very effective. Once you've completed working on the abdomen, then you need to move on to the back. You can see above the gluteus we have all this layer of concentrated fat. You see this line? This is the stomach metamere that is tense. You see it goes from elbow to elbow. It cuts diagonally. Okay, this is an indication of tension, so that means that the stomach is applying pressure. So we have to loosen the whole metamere and also the underlying fascia that I'm working on right now. So you use the palpé roulé technique, you do the percussion, you do all the treatments that we did on the belly and on the legs. So the palpé roulé, kneading, percussion, and the cutaneous and subcutaneous stimulations. Now, I have concluded with this. I think I've explained everything to you. So once you've learned these 4 or 5 techniques, you will really achieve great results, and they will allow you to make a difference with respect to other colleagues, because by working on the liver and the gallbladder metameres and in reflexology, the results will be more long-lasting because you have reestablished a balance in the body. Now, to achieve excellent aesthetical results as well, you will really need to go through a few sessions. So we're talking about 3 sessions a week for a month. So your customer also needs to be available. After that, you will move to twice a week for another 20 days, then once a week. And when you've done 16 sessions like this one, the person will be very satisfied. But again, the first results can be seen after 2 or 3 sessions. These will be the first results. If you continue with the frequency that I've just mentioned, then you will be very happy, but especially the customer. Okay? So, I have completed.
Con questo è tutto, io ti saluto, passo e chiudo.